Hello, everybody. My name is Peter Jihde. As you can tell, I'm not British and I'm not from the US. I am Swedish and I have got diabetes type 1. And I also work at Beat Diabetes Foundation. I'm a board member and I speak a lot about diabetes. The second person you're watching is the most important one today. His name is Andrzej Krolewski is at Joslin Diabetes Center and Harvard Medical School. So I just say hello, Andrzej, and my first question to you is, how come you decided to do your research about my disease, diabetes?
Currently, I'm the professor of medicine at Harvard Medical School and also a senior investigator at Joslin Diabetes Center. I started this research interest in diabetes because some of my relatives had diabetes, so I knew about the disease. The other thing which motivated me to do this research was a lack of competitors. It means that when I started my research, there was so much research done in humans on late diabetic complications. So I developed a research at Joslin where I am focusing on studying what is causing diabetic kidney disease in patients, type 1 and type 2. And I can say that we are making great progress.
I have had my diabetes type 1 since 2012, 12, 12. So it's almost 9 years now. And all the things I use every day, the insulin gets better, the way I monitor my blood sugar gets better, but I am so interested in the research to help with other things regarding diabetes. So please, you as a professor and me as just a regular Swedish person, can you in a simple way tell me what it is that you are doing and how it will maybe help me and others with diabetes type 1?
We started looking at the protein profiles in circulation as well as urine for possible predictors or possible causal factors for the development of kidney disease. We take large group of patients, follow them over time, and monitor who will develop diabetic kidney disease and who did not. Over the last 20 years, I have been conducting study which is referred to as a Joslin kidney study, and we are following about 5,000 patients, and we just finished the observation, and now we'd like to find out what are the characteristics of those patients who develop versus those who didn't develop kidney complications.
Give me please a hint, Andrzej. What is it that you have found so far?
And the findings which I'm sort of mentioning is that we found 20 circulating proteins out of 1,200, which are strongly associated with the development of kidney disease and its progression to end-stage kidney disease.
So what is the next step, Andrzej?
That we are looking at the biology, and we hope that we may find out 1 or 2 or 3 proteins which will be as good for diabetic kidney disease as cholesterol is for coronary artery disease. So if we find out such proteins, then this opens an area of developing therapeutic interventions and new drugs and new interventions. But the other kind of set of goals is related to I can call this a diagnostic, prognostic, and more developing diagnostic, prognostic, and monitoring markers. This 20, the most important thing at this moment, and the immediate goal is to develop a platform which will allow us to measure those 21 proteins. And we are already working with the Olink, it's the Uppsala-based company, to develop this custom-made platform. Once we have this platform, we will do more research to confirm what we found, but also it will be very important at the end to develop a chip which will allow us to diagnose who among patients with diabetes is at risk of developing diabetic kidney disease.
So I know, of course, that you're in the middle of this and that it takes a while, but if we talk about applying this research in a clinical way, what could or will you be able to do, and when?
Depend on two things. One is that we will have a good custom-made platform which will be measuring those 21 or 20 proteins. That is the most important thing at this moment. The next thing is to use this platform in large number of populations, so young, older individuals, type 1, type 2, in different ethnic groups, to see whether the same proteins will be predicting the development of diabetic kidney disease.
I kicked off as a journalist and have now been working as that for almost 30 years. I was a sports reporter from the beginning, and then it's always important to reach the finish line. So if I ask you that question about this project and this research, will it be possible to answer when you think you will reach the finish line, and what have you been able to do then?
Next year or two, that platform will be tested under many different conditions in different populations. So we are expecting that within 3 to 4 years, we will have some form of platform which can be used in clinical setting.
And I'm so happy, Andrzej, that you are doing what you are doing. And I'm also very happy that you took your valuable time talking to me. And I hope that you will have a great World Diabetes Day, which is the 14th of November every year. Thank you so much for talking to me, and have a good day, and please return to the research immediately. Thank you and goodbye.